Hi everybody, in this video we'll be discussing on how to diagnose a frozen shoulder. Frozen shoulder is a condition where the capsule of the shoulder joint will get tight and adhered, and hence it's otherwise called as adhesive capsulitis. So many people are suffering with this condition, and only if these patients were identified their condition early during the course of the disease, their future pain and disability can be maximally reduced. Hence, I'm going to talk with these 6 points to make you understand whether you have a frozen shoulder or not. Let's discuss one by one. The first one is pain locality. Where do you think the pain will be in frozen shoulder? Of course, in the shoulder joint. People will have pain over the joint line, and some of the patients will have pain going down to the arm level. Especially when they move their arm, the pain shoots down to the arm too, and they have to catch their shoulder and do a little bit of pressing kind of activity like this. But the pain cannot go down to the elbow joint. If the pain travels down to the elbow joint, and if the pain is felt in the fingers with tingling and numbness, then it is not frozen shoulder, because frozen shoulder manifestation cannot cross the elbow joint, or definitely will not cause wrist and hand pain. Plus, if the pain is in the medial scapular region here, or if the pain is in the back of the neck, you may have underlying neck problem which may contribute to their pre-existing frozen shoulder, or you will have only the neck problem which mimics like a frozen shoulder. So it's very important to diagnose whether you have an underlying neck problem or not. So the pain locality wise, it should not go down to the elbow, it should not be over the scapular region, medial scapular region, or over the back of the neck. That's about the pain locality. The next one is the nature of the pain. The pain would be gradual in nature. All of a sudden you won't get frozen shoulder. Tomorrow morning when you wake up and if you could not lift the arm, it cannot be a frozen shoulder, because in frozen shoulder the pain will be gradual in onset. Slowly they feel that the movements are getting stiff, and then at some point the movement will become grossly restricted. So the pain will be gradual in onset, plus it will be of achy and agonizing and annoying pain inside their shoulder. And night pain is one of the hallmark for the frozen shoulder. When they sleep at night, they'll have trouble in identifying a comfortable position. They have to toss and turn throughout the night, and they have to find a comfortable position to sleep at night. And then jerk pain. What is jerk pain? A sudden unexpected movement happening in the shoulder will cause a shooting lightning like pain all over the shoulder joint. It's something like unexpectedly they lift something on the top of the shelf, unexpectedly they reach the back of the car seat, they had to repent for it because it will cause severe pain, and they have to almost like weep for about 2 minutes. The pain will be staying on, and then they will become normal. So this is one of the characteristics of frozen shoulder. We call that as jerk pain. Additionally, some patients will have tingling, numbness, paresthesia in the arm, in the fingers, sometimes in the little finger, sometimes in the index finger. If that is the case, straightforward you need to go to the neck, because only neck problem, let's say cervical disc herniations or disc bulges or radicular nerve compressions, these are the conditions where the patients will have problem in the finger or in the wrist and hand. If you are thinking that you have frozen shoulder and simultaneously having problem in the hand, then you may not get complete recovery from your frozen shoulder, because you will have an underlying neck problem which is silently inhibiting from your maximal recovery. So if you think so that you have problem in the hand, then you need to treat your neck too to get complete resolution of your frozen shoulder symptoms. The third one is the movement pattern restriction. What would be the movement pattern restriction in frozen shoulder? The shoulder joint moves in 3 planes. The sagittal plane, where the flexion extension happens. In frontal plane, the abduction adduction happens. And horizontal plane, where the internal rotation, external rotation happens. In frozen shoulder, at least 2 planes should be involved. In that, one plane should be a rotational plane. Means, as a simple test, I ask my patients to touch their back this way. If they could not touch, more or less, it is confirmative of frozen shoulder. But of course, you need to do test the other parameters also. So, at least there are 2 planes that should be involved in frozen shoulder in terms of movement restriction. Then, the active range of motion will be almost equal to passive range of motion. When the patient actively moves the shoulder this much, and as a therapist, if they move the shoulder passively, it should be almost the same. It's not like the active movement is this much and passive movement is this much. If this large difference if you find between active and passive range of motion, then you can rule out a frozen shoulder, because in frozen shoulder both active and passive would be almost the same range. Then the combined movements. The capsule will get more tightened if you combine the movement using 2 planes. For example, in this position, the shoulder joint is causing extension, adduction and internal rotation. It's a combination of three movements here that causes this movement. Okay, so when you combine the planes, the capsule will get even more tighter and then you get the pain. One more example is this movement. You have adduction and you have internal rotation. Two movements are combined to cause more stretch to the capsule that produces the pain. So the combined movements would be even more difficult compared to the uniplanar movement. Then palpation. What is palpation? You touch and then you sense. Palpation in frozen shoulder will be very handy, especially when you palpate your coracoid process. Coracoid process is a spot just under the lateral clavicle over here. The coracohumeral ligament will be inflamed and tender in acute phase of frozen shoulder. In other words, you can call it as a freezing phase of the frozen shoulder. The coracohumeral ligament will be tender to touch, and hence we call it as a coracoid process palpation test positive. That indicates that it can be a frozen shoulder. So the on touch, the coracoid process will be painful. Apart from that, you can palpate the deltoid, anterior deltoid, mid deltoid, posterior deltoid, or your infraspinatus, teres minor. So these are some of the muscles which may develop secondary pain due to the frozen shoulder. So palpation wise, coracoid process pain and arm pain can be confirmative of frozen shoulder. Next is functional restriction. People with frozen shoulder will have difficulty in combing, will have difficulty in removing their jacket, wearing shirt, reaching their opposite side shoulder to adjust their sari for Indian ladies. These are some of the functions which will be severely affected in frozen shoulder. Next is X-ray. Do all patients with frozen shoulder need an X-ray? I don't think so. We usually take X-ray in order to rule out other red flags or other pathologies, like if the patient is having rheumatoid arthritis or any other inflammatory condition, or had a history of fall, or had a history of tumor or tuberculosis. In such cases, to rule out other condition, we take an X-ray. In pure frozen shoulder, the X-ray will be clean. Maybe some frozen shoulder condition where the head of the humerus will slide anteriorly or superiorly translate because of the tight capsules, but we don't see that with all patients. If you fulfill all the 6 criteria, more likely you should have a frozen shoulder. So quickly start your physiotherapy treatment in order to prevent the stiffness and in order to treat your pain. I hope you liked our video. Keep watching us for future videos. Thank you so much.